Hello, it's Dr. Erica. Thank you for joining me. I am going to talk about a serious topic, medical topic, uh, that is prevalent usually in the media and the news. And so it's a topic that I want to discuss. And as a pharmacist for close to 10 years now, I've had several experiences where I've counseled and dispensed narcotic opioids and have looked for medical interactions, drug interactions, also interactions between a person and the medication itself. So now that I have had experience, I can speak upon it and give some advice on how best to take narcotic opioids and when to take these items versus taking over the counter Tylenol or NSAIDs or comparing those products. I can do that as well as let you know what options to choose to offset some of the adverse effects, side effects, things like that. So I recently was able to take for moderate pain a narcotic after utilizing Tylenol for the minor pain. The minor pain became more intense into moderate pain. And so I took half of a tablet of a narcotic because I myself, when taking narcotic, know how my body, my mind reacts to the side effects. Some of the side effects can be drowsiness, changes in respiratory rate, can also be nausea, vomiting sensation. There can also be itching and hive development as well due to the histamine interaction of narcotics. And so when I was able to take half of a tablet, I was still sensing a lot of the side effects. That wasn't even the full strength. I took half of a 7.5 of the hydrocodone tablet just because I wanted to get rid of the pain, but I did not want to experience the side effect. And so, because I know myself and how I react, I was able to adjust accordingly. Now, it was diagnosed some time ago, and I was prescribed a narcotic with a prescription that I filled, and I was advised to take 4 times a day. I could not take the item 4 times a day. I can only take half of a tablet only when needed because of that particular interaction that happens with myself. And I don't want to become psychological or physiologically dependent upon opioid narcotics, so I adjust accordingly. And I also suggest that for other patients as well. Also, I recommend that you speak with your personal healthcare provider, your personal pharmacist where you are, and ask them about alternatives to narcotics. Ask them about how to relieve pain that is non pharmacological, which includes exercise, changing in dieting, seeing a physical therapist, and so forth. And then also talk with your healthcare provider or pharmacist to ask about not only alternatives, but ask about the rescue medication called naloxone, also called Narcan. Narcan is a good rescue medication to help with respiratory rate increase for those patients who experience side effect of respiratory depression when taking a opioid narcotic. And now also patients can pre-medicate before taking a opioid narcotic with Benadryl. Benadryl will help with lessening the side effect of itching and hive and also any anaphylactic reaction. So Benadryl is another medication to have on board as well to offset side effects. Now, I do suggest over the counter medications first, if possible, such as Tylenol, which has a low side effect profile and can be used around the clock to help with mild pain. And I do recommend NSAIDs which are non-steroidal anti-inflammatory drugs that can be used around the clock as well, and it has less intense side effects. But I do not recommend it in those patients who have ulcers, stomach ulcers, abdominal bleeding, or any type of GI bleeding. So, do recommend you speaking with your healthcare provider first to find out which medication for pain is going to work best for your situation. Now, narcotics are usually prescribed, and they prescribed only, and they are prescribed for patients who have undergone surgeries, persons who have undergone labor and delivery, patients who are orthopedic, patients, patients who are uh, very much in dire need of pain relief. And so that's when we see a um, a a a indication to receive a prescription for a narcotic. I do not recommend narcotic therapy unprescribed. I do not recommend opioid narcotic therapy utilized with alcohol use, also with other pain relieving and muscle relaxing medications, because this can be detrimental to the heart rate and the respiratory rate, leading to death. So I do recommend that you seek out your healthcare provider where you are for personal detail and personal recommendation. Again, there are alternatives to pain relieving medications that are non pharmacological, and that include weight bearing exercises and aerobic exercises, also physical therapy, and then also there are water weight exercises as well, water aerobics that can help. And then there are other exercises that will help you, like stretching and things of that sort, will help stretching. All that will help to reduce pain and help to reduce the amount of narcotic opioids that are used on a regular basis. Do speak with your particular doctor first and let them know what your thoughts are and that you would like to reconsider therapy. And I have had several talks with other people, other patients in consultation settings to help them come off of narcotics. And patients have tried and have been successful. So it is, again, achievable. So, with that being said, I am Dr. Erica. I'm a pharmacist, and this is my suggestions to you. You can leave any comments that you have. Let me know what your thoughts are, and I can get back with you. Thank you for liking and sharing. And also, do please subscribe to this channel. Take care. Bye bye.